In today's show, we're going to be speaking with registered psychologist Dr. Erin Moon about kidney disease and mental health, and we're going to explore the relationship between the two. We're going to talk about the prevalence, just how common are mental health challenges with kidney patients. We're going to look at some of those red flags, some of those warning signs. We're going to talk about coping mechanisms and strategies, and when to consider seeking professional help and treatment. So we've got a jam-packed show. Don't go anywhere. We're going to be right back with Dr. Moon. Nice to meet you, Dr. Moon. Thank you so much for taking the time to be plugged in today.
Absolutely.
Thank you so much. Can you talk about some of the red flags for mental health issues with kidney patients?
So I think it's important to recognize that low mood or depression or a significant anxiety concern is different from just a normal reaction to a stress in life. So the reaction would tend to go on for quite a period of time, so longer certainly than a couple of weeks. So if someone is feeling low and sad or very anxious, most of the day, more days of the week than not, and that goes on for a period of time, when we're into sort of many weeks or months, then that's an indication that people could really benefit from additional support. But the other thing to look out for too is just the impact on the person's day-to-day life. So if the struggle with mood or anxiety is getting in the way of getting to work or getting to school, doing normal activities that the person enjoys, if they're not able to do those things in the same way, then I would say that that's a red flag as well for some extra support.
Can you talk about some common healthy lifestyle tips for people who are facing mental health challenges?
It's important to think about sort of going back to the basics. So things like healthy eating, prioritizing enough time for sleep, getting exercise is a really critical piece, and there's research that's growing to show us that exercise in and of itself can be really helpful for things like mood and anxiety. Also getting outside. For adults, it's really important to avoid drugs and alcohol, which might in the short term give some relief from things like low mood, but in the long term typically make it more complicated. Managing stress, reducing stress whenever possible, calling in your support system, seeing if there are some things in the course of your week that you could, give up for a period of time. Doing things like yoga or meditation, whatever you do in your life to manage stress, anything that gives you relaxation. It can also be really helpful to connect with other people. So making sure that you reach out to your friends, your family, your support system. And so that might just be, informal, going for a coffee. It can also be more formal, like getting support from other people in the kidney community, through the Kidney Foundation, the different supports that are available. So all of those things can really go a long way to helping people manage stress, which then can have a positive impact on their mental health.
When those common coping mechanisms aren't working, at what point should someone consider seeking professional help?
If those struggles like a low mood or anxiety go on for quite a period of time and it is getting in the way of day-to-day life, then it is time to think about asking for help and support. So for adults, a really important person to start with would be your family doctor. Also your kidney care clinic team. So those are all really good sources of information and resource, and those members of your team can certainly direct you to other resources that exist in your area. Some people can access counseling through their employee assistance program, so that can be something really helpful for adults to look into. And then when it comes to crisis services, it's also really important to know that those exist 24/7. So, in your local area, there will be crisis services and crisis lines that can click in if someone really needs in the moment support.